Welcome. I'm a nurse practitioner at Upstate Medical University in Syracuse, New York. I am honored to be part of the team providing medical care for many refugees resettling in our community. During the next few minutes, I will inform you about immunizations, also called vaccinations or vaccines. It is important to know about vaccines because they can help prevent many harmful diseases.
Vaccines protect you against certain infections, like measles or tetanus. Once injected into the body, your body learns to recognize and fight the germ in the future. Without receiving an immunization, a child may not be strong enough to fight the disease when exposed to the bacteria or germ. Before vaccines, many children died from diseases that vaccines now prevent, such as polio, whooping cough, and measles. Now that all babies and children receive vaccines, it is very uncommon to see a child or adult with these diseases in developed countries. There are many types of vaccines. Each one fights a different disease. Immunization is common all around the world, but different countries require different immunizations based on the most common diseases in each country and the cost of the vaccine. Many refugees have received certain vaccines before immigrating, but still require additional vaccines in their new country to prevent disease. Certain vaccines are required for immigrants to advance to citizenship. In the United States, for example, proof of immunization is required to receive a green card. Children often receive different types of vaccines than adults. For example, one very important vaccine is the tetanus, diphtheria, pertussis, or Tdap vaccine. This vaccine gives you protection against all three of these diseases. Protection against pertussis, which is more commonly known as whooping cough, is very important in young children. Whooping cough can lead to serious, severe coughing spells, difficulty breathing, vomiting, and disturbed sleep. Tetanus is a deadly infection that is often caused by a cut from a rusty object. Another important vaccine is the influenza vaccine. The flu is caused by the influenza virus, which can be spread by coughing, sneezing, or most frequently through lack of proper hand washing. Influenza is not the same as the common cold or the stomach bug flu. Influenza causes high fever, very sore body, makes you feel sick, and often causes pneumonia. Many people die from influenza each year. The seasonal flu is more likely to occur in the winter months, which is when you can receive the influenza vaccine. By getting the flu vaccine, you can protect yourself from influenza and may also avoid spreading influenza to others. However, you must receive the vaccine each year. Vaccines are given in different ways, for example, by mouth, through injection, or through the nose. Vaccines are very effective and usually safe. However, if you or your child experiences any unusual symptoms, such as high fever, rash, behavior changes, or difficulty breathing after receiving a vaccine, you should call your health center. If a woman is pregnant, she should tell her doctor. Certain vaccines are not appropriate to give during pregnancy. Prior to receiving a vaccine, all women should receive a blood or urine test to determine if they're pregnant.
To summarize, vaccines are very important to your health and are necessary when seeking permanent residence in a new country. There are many different diseases that vaccines are able to prevent, and there are several different types of vaccines that everyone receives. In most cases, adults and children receive different vaccines. Most vaccines are injections. Thank you for listening. We at Upstate Medical University in Syracuse, New York, hope that this information has been helpful to you and are grateful to the generous contribution of CNY Community Foundation. We wish you the best.